Can I thank the convener and the committee for the deliberations on this informative and challenging report. The subject of this debate is relevant to us all, Deputy Presiding Officer, as the convener of the Health and Social Care and Sport Committee rightly pointed out, relevant to all areas of life, all areas of government and all areas of parliamentary scrutiny. Today I want to reflect on the work that the Constitution Europe External Affairs and Culture Committee have looked at in relation to the wellbeing society to which we all aspire. I want to cover three areas: culture's wider benefits, mainstreaming and preventative spend. And if I could start with what the University College London described in its submission to our committee as the Grade A evidence on the impact of music to support infant social development, reading to support child social development, and the arts to support aspects of social cohesion, improve well-being and reduce physical decline in older age. The World Health Organization cited 3,000 studies which identified a major role for the arts in the prevention of ill health, promotion of health and management and treatment of illness across the lifespan. The challenges in fulfilling the arts role, according to Creative Scotland, are multifold. They're around funding, awareness, staffing, integration, whether we can reach those most compromised by inequality, building partnerships and evaluation. How do we measure what works as a preventative spend? And of course, inequalities of access to the arts play their part in these challenges. Presiding Officer, we should not underestimate the severity of the cost of living crisis. Our pre-budgetary scrutiny found a perfect storm of financial pressures facing the culture sector, and I'm sure other subject committees will have had similar evidence. But these are challenges we must overcome if we are to make the most of the transformational power of culture. Mainstreaming, as my committee and many others condemned, is a means to do just that. Audit Scotland has made the case for a different thinking about what we consider to be health funding, because health is much broader than the National Health Service. Which is why, when the committee took evidence on the resource spending review, such as our commitment to mainstreaming, we took evidence on the published review from both the Cabinet Secretary for Culture and the Health Cabinet Secretary at the same time. COSLA challenged us and called for a whole system thinking when it comes to addressing the social determinants of health. National Galleries of Scotland highlighted the many individual cultural aspects and initiatives relating to health and wellbeing in Scotland, but they found these to be fragmentary and not joined up by any national strategy or framework, and actually described the ambition to embed culture in health as still rotating in mid-air in rhetoric. But the Deputy Presiding Officer, it's nearly 12 years since the publication of the Christie report, and lest we forget the four pillars were partnership working, prevention of negative outcomes, reducing duplication and empowering individuals and communities. Sense Scotland told us we need to start to think, act and spend differently, to see prevention within an investment paradigm. Invest now and a flow of benefits will be released over time. There are a lot of culture projects out there working to support health and wellbeing. I'm delighted that we have been able to see some of them in action, whether that be storytelling workshops for children, dementia inclusive singing networks, or art in hospital programmes. However, we need a better understanding of what works, who it works for, and when it should be delivered. That understanding can then drive a greater use of cultural services in the support of health outcomes. Thank you.